Simon Adesu is just leaving home for work. Adesu is a farmer, but last year he decided to hire extra help so that he could train and become a mobile health worker instead. Today, he's holding a meeting to educate the community on malaria prevention.
During the session, I showed them how to use treated mosquito nets properly. I talked about mosquito bites and how this can lead to malaria and other complications. I also talked about hygiene and told mothers that they must ensure children wash their hands after visiting the toilet.
In the past, many in the area had to go without medical help unless they could get to the nearest health centre about 3 kilometres away. Most residents are happy that they can now get health services without having to travel very far.
Because UNICEF has a representative in the village, I can take my son to see the health worker when he is sick, and if it's serious, then we will be referred to the hospital for treatment.
The program is run by UNICEF together with local authorities and the Health Ministry. Already, 4 districts have taken up the model, which will be replicated in other parts of the country soon.
We are confident we keep in day-to-day contact with the local authorities and health workers in districts that UNICEF has signed contracts, so that after an 18-month period during which we cover the payments for extension workers, the local authority will be all set to take over and carry on.
About 600,000 people living in the countryside now have access to mobile health extension workers. These workers are trained and equipped with basic generic medicines. Doctors say there has been a significant drop in cases of malaria and other ailments recorded at the local K2 Health clinic in recent months.
The health extension workers are making a clear impact. We see it especially in terms of consultation and admissions we record here at the hospital. We have trained them to identify or treat primarily malaria, severe respiratory illness, diarrhea and malnutrition. Based on the number of hospital admissions and consultations we are seeing now, it is very clear that the extension workers are having an impact on the ground.
The program hopes to discourage community members from turning to herbalists or unregistered mobile pharmacists who travel by bicycle selling drugs, and instead to seek safer treatment options.